All-inside ACL retroconstruction is a technique designed to allow minimally invasive repair of a torn anterior cruciate ligament. If the torn ACL is not repaired, meniscal tears and arthritis may develop in the knee. The surgeon begins by flexing the knee and inserting a passport cannula through a small incision on the inside of the knee called a medial portal. A drill guide is then inserted through the cannula, and the guide is placed in the location where the injured ACL attached to the femur. A guide pin is drilled through the thigh bone and out through the skin. The guide is removed and the guide pin is backed up to reveal the length of the tunnel. A drill is inserted over the pin. The femoral socket where the graft ligament will be placed is drilled to the desired depth. A suture is passed through the drill hole and stored to assist in passing the graft at the end of the operation. Another guide pin is inserted, and a second socket is created in the same fashion. The knee is relaxed, and another cutting guide is then inserted into the knee. This guide holds a detachable drill bit at its tip. The drill bit is centered over the site for the desired socket in the tibia, or leg bone. A guide pin is inserted into the knee from the bottom up. This pin engages the drill bit and captures it on its tip. By pulling back, the drill bit is released from the drill guide and is used to drill a socket in the top of the tibia. When the socket is drilled to the desired depth, the drill bit is brought back onto the tip of the drill guide and reversed. The guide pin is left in place, while the drill guide and bit are removed. A suture is inserted through the guide pin, and both sutures are retrieved through the cannula. The pin is removed, and the sutures in the femur and tibia are then used to pass one of the grafts into the joint. Sutures on the end of the graft that hold a small metal button are passed through one femoral socket, and the button is passed to the outer aspect of the thigh bone, where it automatically deploys into position. This secures the ACL graft in the femoral socket. The sutures on the other end of the graft are then shuttled through the tibial tunnel and the graft is passed into the tibia. A thin wire is shuttled into the joint through the cannula and through the tibial tunnel. A screwdriver is then inserted over the wire into the tunnel in the tibia and placed into the joint in front of the graft. A suture is passed through a hole in the center of the screwdriver and brought out the front of the knee. A retro screw is placed over the suture and inserted into the joint. The knee is extended and a grasper or tamp is used to align the retro screw with the tip of the screwdriver and to push the screw down onto the driver. The screw is turned down counterclockwise into the tunnel. The graft is pulled down with the screw and is observed to tighten as the screw is turned into its final position. The graft is now secured in the tunnels until it heals to the bone. Once the first bundle of the graft is secured into place, the cutting guide is reinserted, and a second tibial socket is drilled anterior to the first. The second bundle of the graft is passed and secured in a similar manner.